Has the dental work in your mouth turned you into a walking antenna? One day, I was driving past two big cell phone towers, and I thought about what those antennas were really doing. Obviously, they were amplifying my phone reception, but they were also transmitting microwaves toward my head as I wore my phone headset. I thought about the possibility that shiny metal dental restorations, and especially titanium implants, because they go so deep into our living tissues, could be acting like antennas for the microwave transmissions going on between our cell phones and all of the cell phone towers in our 21st century environment. I strongly suspect that this is a new form of high-tech stress to our bodies. Remember that shiny metal dental restorations and titanium implants have already been shown to cause galvanic and electromagnetic stress for the human body. The microwave attracting stress just makes it worse. A study by Dr. Mortazavi in Iran confirms that the amount of mercury released from amalgam fillings is almost doubled by a patient's use of cell phones. Heavy metal detoxification can be blocked in a patient due to the presence of toxic EMF exposure in the patient's environment. And removal of toxic EMF exposure has been found to allow a breakthrough in heavy metal detox. Melatonin production is blocked by the presence of EMF exposure, and this can cause decreased tissue repair, difficulty sleeping, weakened immunity, heart irregularities, and cancers. MRI scans increase the release of mercury from dental amalgam fillings. I see my patients being more affected by their shiny metal dental restorations and titanium implants. Women, especially menopausal women, with titanium implants seems to be particularly affected. The titanium implants, especially when they are combined with other toxic teeth, are causing sleep disturbances, anxiety, and other neurological problems, thyroid dysfunction, digestive problems, heart problems, and other chronic symptoms in a number of my patients. I recently saw an out-of-state patient who came to my office after visiting 20 different physicians, including some at the Mayo Clinic, for nightly adrenaline rushes, where her heartbeat raced and she wasn't unable to sleep. The only treatment this patient was offered was antidepressants and sleeping pills. But there was one question every physician forgot to ask. What is in your mouth, especially since those symptoms started a year ago? The first doctor to ever ask that question was me. Sure enough, she had titanium implants and a root canal around that time. This patient also had a long history of other dental work, including shiny metal crowns, porcelain fused to metal crowns, mercury fillings, root canals, and a permanent metal retainer. Adding those titanium implants and another root canal probably pushed her body into a seriously imbalanced state, causing her severe health problems. After I removed her mercury amalgam fillings and her permanent metal retainer, she experienced a lessening of her symptoms. I expect that she will see further improvements after removing her titanium implants. Humans are made up of different layers, different energy fields, including bioelectrical fields and musculoskeletal systems. It takes time for the different layers of our being to adapt to all the stressors in our environment, from toxic chemicals in our air and water to the stress of our jobs and relationships. And now it is becoming common for Americans to have somewhere between 3 to 5 titanium implants embedded in their jawbone just a few inches from their brain. When titanium implants or root canals are added to a compromised body that's already lacking enough adaptive or healing energy, the physiology of that body will break down even faster. This is a consequence of stress overload. Titanium implants, root canals, mercury amalgam fillings, and other shiny metal restorations will be a stress to anyone's body. One person might be able to handle these types of stress, but another person may not. Because of this, We should always be very careful in considering when to have extensive dental work, especially titanium implants. Be aware of the dental work in your mouth and cell phone usage so you do not turn into a walking antenna. Finding a dentist who truly practices with holistic awareness, along with taking some responsibility for educating yourself about the dental treatments you may be having, will help you make the right choices for your general and long-term health. I highly recommend that you, your family, and your friends read my book and become aware of your dental choices. Well-educated choices may result in health rather than disease, longevity instead of premature death. May you continue to watch, listen, learn, and be empowered. Join me in waking up our nation in search for health and true freedom. Thanks.